Advanced Technologies. IMSI. IMSI is a new generation microscope that allows us to visualize the sperms 10,000 times larger, to distinguish the ones that present the best morphology and are therefore more suitable for fertilization. According to several published studies, IMSI improves the chances of pregnancy and reduces the abortion rate. Polarizer and controlled atmosphere booth. Moreover, our laboratory has other special equipment, such as the Polar AIDE image polarizer, which allows us to observe the most important structures of the egg and to distinguish the best quality eggs. We also have a controlled atmosphere booth in which eggs or embryos are kept in the same conditions of temperature, oxygen, carbon dioxide and humidity, such as they were in the womb. Embryoscope. It is a new generation incubator equipped with a video camera that can observe at all times the development of the embryo. With this advanced system, we can monitor the embryos second by second without having to take them outside to check their state, thus keeping them in more stable and secure conditions. Techniques. Polar body biopsy. Institut Marquès has an extremely advanced technique to analyze the chromosomes of the eggs and discard those that have abnormalities. This technique is called polar body biopsy and pre-implantation genetic diagnosis of the egg. A small hole on the membrane of the egg is performed to remove cells, called polar bodies, that are not necessary for development but give us invaluable information on their chromosomal load. Once we get the result, we can transfer only the embryos from healthy eggs. Fragment removal, makeup. Embryo makeup is one of the techniques used to eliminate cellular fragments that impede embryonic development. It consists of puncturing the embryonic membrane and aspirating the maximum amount of cellular debris. In this manner, we manage to change the appearance of the embryo and restore its pregnancy potential, hence its name. Assisted hatching. As women get older, the membrane covering the embryo, or zona pellucidae, may become harder or tougher, making it difficult, hence impeding implantation. In order to facilitate this process, we perform what is known as assisted hatching, which consists of puncturing a small hole in the zona pellucidae. Freezing or vitrification of eggs and embryos. Embryos that are not transferred and have good chances of implantation are frozen or vitrified. To vitrify means to freeze in an ultra-fast way, preventing the formation of ice. Vitrification is also used to freeze a woman's eggs in order to use them the day she decides to become a mother, storing younger eggs and therefore of better quality. This technique allows us to preserve women's fertility before a treatment for cancer, for example. On the other hand, it enables a young woman to postpone motherhood and have a child of her own genetic material. Pre-implantation genetic diagnosis. Conventional assisted reproduction techniques select the embryos to be transferred based on morphological criteria, that is, observing their form and external aspect. However, the chromosomic count cannot be detected under the microscope, as embryos of an apparently good aspect may present anomalies and, as such, lack pregnancy potential. In order to determine whether an embryo has a correct chromosome count, a pre-implantation genetic diagnosis should be carried out. This allows us to evaluate the chromosome state of conceived embryos, hence ensuring that only healthy embryos are transferred to the uterus. Pre-implantation genetic diagnosis is a combination of in vitro fertilization and genetic analysis. At Institut Marquès, thanks to our commitment to research and development, we can analyze all the embryo's chromosomes in one cell. This allows us to detect more abnormalities and improve the chances of pregnancy. In advanced maternal age, we can even increase the chances of pregnancy by 3. analysis. Embryos fertilized in vitro are left to develop over 3 days, considered to be the period required for analysis. 1 or 2 cells are extracted from the embryo by performing an embryo biopsy. However, this does not compromise normal development. Once the biopsy has been performed, the embryo is returned to the laboratory incubator, where it will be kept in an in vitro culture medium under adequate environmental conditions and allowed to continue its development until it is due to be transferred to the patient's uterus. The cell obtained is processed for analysis and submitted to genetic study. A detailed report on the results of the analysis is forwarded to the assisted reproduction team, who, with the clients, decide on the number of healthy embryos to be transferred.